Amo pama ba me voye menya me ka oje ma wo pa e agbere enya kla kanya to nya fonu ba u barelo enya kla kanya to nya.
Ghana's maternal mortality rate in 2017 stood at 319 deaths per 100,000 live births. The figure represents a significant improvement over what existed in the 1990s, but far above the global target of less than 70 deaths per 100,000 live births.
As an organization, Savana Signatures believes that we have a duty, and it's also our calling to contribute to the attainment of the Sustainable Development Goal 3 and 5. Now we want to contribute to the reduction of maternal and child mortality in Ghana. We are using about 3 or 4 pronged approaches, or if you like, strategies to be able to achieve this through the delivery of weekly SMS and voice messaging to expectant mothers who enroll on our program, through what we call the knowledge sharing sessions at the facility level, and then also at the community level through what we call the community electronic medical records, and then through the research fund.
Over the years, various reasons have been advanced for the high rate of maternal mortality in Ghana. However, the greatest challenge perhaps lies in the attitude of the individual and family towards seeking health care. There are other factors that contribute to maternal deaths, such as inadequate critical health personnel like midwives, gynecologists, and a smooth referral system. Over the years, the nation has used various strategies to address maternal deaths with some success. However, the gap shows clearly that new strategies are required. In 2016, Savana Signatures, with funding from Global Affairs Canada, introduced the Technology for Maternal and Child Health Project, T4MCH for short.
Each week, through SMS and voice, we use a platform called the Pododo platform that transmits weekly messages to expectant mothers. Now, these weekly messages are according to the gestation period of each expectant mother. We have translated these messages in 11 Ghanaian languages, and so at the point of registration or opting into the program, either at the community level or at the health facility level, each expectant mother has the option to opt for one out of 11 Ghanaian languages that we have. And so for voice, if they are illiterate or if they do not understand English, they can opt for the voice messages, and so voice messages are transmitted to them. And then if they are able to read in English, they can opt and subscribe to the delivery of SMS. Now, through what we call the knowledge sharing sessions, we have some support that we give to the facilities every month, and they use that to organize knowledge sharing sessions. We have provided ICT equipment that the health staff use to organize some of these sessions, both in English but also most importantly in the dominant language within where the facility is located. And this knowledge sharing session is geared at bringing the health staff and then the expectant mothers and their partners together to really deliberate and discuss issues about their pregnancy.
Actually, I may say the T4MCH program, it has really helped us so much. Looking at our indicators, delivery, only when we compare our 3-year trend of our scale delivery, it has actually increased. 2015, total deliveries conducted for the year was 9. Then for 2016, total delivery conducted was 69. And then this year, total delivery conducted so far should be 100 plus actually. This has been possible because after we started this the T4MCH program, most of our mothers have the opportunity to benefit from the knowledge sharing section. We have been doing knowledge sharing section formally that we call health educational talk. But by then we don't have the equipment that will help us to deliver the messages we want our clients to pick. But I think with the help of Savana Signatures and the Global Affairs Canada, they have given us a projector, a laptop, and the PA system that we are able to use to talk to our clients, and then they are also able to utilize the PA system with us, so that everybody that is at the section could hear whatever each client is saying.
The project is being implemented across 33 health facilities in the northern, upper west and Volta regions of Ghana. One of the key pillars of the T4MCH project is the Knowledge Sharing Session, also known as KSS. The enthusiasm at Daboya, where the health workers organize a video show every fortnight to sensitize the community on the dangers of home delivery, is very high. During these sessions, residents of all ages turn up to watch the program. Pregnant women most especially have found the show very useful. The midwife for the Daboya Health Center, Esther Afedo, reveals the significance of the KSS.
It's about a woman. They talked about how they should attend the ANC and how they should go about it. And this latter part was how the woman was in labor and the man went to the fetish priest to collect medicine for the woman, that he would not allow the woman to go to the hospital to deliver. So the woman passed on in the house. Now that he is following the assemblyman to come and help him send the woman to the hospital, where everything is too late. That's why I was telling them to come for the skill delivery, because these are some of the things we are refusing. If you come, if early complications we can detect. If we cannot manage it at our level, early referral can save your life. So that's why we've been talking to them. They should come. And it will prevent them. Your baby, you can have your baby. If your baby is asphyxiated, can the TBA do something about it? No. But if it's in the hospital, we will resuscitate the baby for you. And you yourself, if there's any problem, we see that and manage it for you. Then you have your baby and you also be fine.
Access to adequate and timely health information is also a major contributory factor to women losing their babies and their own lives. T4MCH uses a mobile messaging system to deliver weekly voice and text messages to expectant and new mothers. The messages are delivered in 11 local languages spoken throughout the 3 regions of Ghana where the project is being implemented, while SMS is delivered in English.
Yaman Bendaro just make a farmer caller. O call my 1 week comes or I call her mum, Hale comes with Bahartizan. O call my dad only tea fan of pump. Be shared I mean, because I jumped to Zanka being a mele. Ka o call my can o call my chamkani, Yakarbansan. Ka I jump to Zam.
Yaman were to town fan of pump. No one didn't go from my head to judge my Tavinia. Never bad or pay or buy a Darshana of Bagu. Katian, Kativan, the down fan. Many them are catching Katima Kamala.
Those are the Tony Iris in Cola to Pam, Macalabana Parampa. I don't know Zambo. Kevin Bankanina, I know Banka, is waiting by the Mulu.
Bundao, let they go the mansion. هل انتظام يرشح عشان أشوفه نتجرع ناوي يكون بعند أفسد ما نلعب بعرش ده بقوم رزقه إني ردان فانا ده ما نلعب بعرشفته من يدنا تلعب لانزي من شعب.
That somebody could hear something in his or her own language, and that will prompt the person to say, yes, I am going. And I think from the time we started, we have had quite a positive response.
An integral part of the T4MCH is the formation of father-to-father groups where men in the communities are sensitized using the Father's Journey Manual developed by the project to, among others, support their wives with household chores, especially while they are pregnant. The program also recognizes the role of religious leaders in the community and involves them in the sessions.
Anytime they are having meeting, they used to call us to come and participate. They used to tell us about health matters, especially about our pregnant women, how we will see to them so that they will be attending that is, was it in antenatal or what? So that we should encourage them. Sometimes we even go with them to the clinic so that the nurses there will counsel them how to take care of themselves.
The T4MCH project's gender mainstreaming activities target men in what we call the father-to-father groups, where we engage men to influence their attitudes about some negative cultural practices that makes it difficult for men to willingly assist their women in household chores, or to even assist in taking them to health facilities during pregnancy and during newborn care, because they are usually labeled with names when other men see them doing this. And then why do we have to do this? Because we feel that when men are supporting women to access health care, then we're going to achieve positive health outcomes where we'll have women get pregnant and deliver safely, and we'll have babies born and live up to see their first 1,000 days. You would agree with me that gender equity is very, very essential if we are to achieve a society where there will be women will get pregnant and deliver safely, women will deliver children, and the children will live to see their 5 years. Gender equity is really very, very important, and that is what the father-to-father group concept is addressing in the project Technology for Maternal and Child Health.
Though the T4MCH project is in its formative stages, the Ghana Health Service says it's beginning to yield results.
We were happy to receive the assistance from Savana Signatures by way of public address systems, projectors and laptops, which we deployed to a number of districts where the project is working on. And this has helped in our Ghana Health Service policy of bringing the help to the doorsteps of people, because remember, our main policy of delivering primary health care is by way of CHIPS and district and sub-district level health service delivery. So if you look at that, community neighbors are an integral part of the work of the district and sub-district health delivery system. So the scaling up of T4MCH definitely will be a welcome thing, because it's covering just some few districts, and the impact is great because we're expecting to have more mothers having skilled delivery and more mothers attaining 4+ antenatal coverage. So if the opportunity is there to scale this to cover the entire region, if not the entire country, I think it's a welcome thing, so that it will help to reduce the hardships the mothers will go through during labor, and to also help to reduce maternal mortality.
My wife's first delivery was terrible for her because she was not attending a clinic by the time she was pregnant. The local woman delivered her, and it was serious on that very day she was to deliver. It took her so many hours before she delivered. So through that, she suffered. Some women were chosen in our village, about 4 of them, that they should always deliver a pregnant woman in the village. Now they are always told to go to the hospital and deliver there. So in our village, there is no a woman who will deliver in the house. Even if it impromptu, that she forced, we always forced to let her get to the clinic, because there is a clinic near our place there. And even Jinabo here in Congo is not far.
Through what we call the Community Electronic Medical Records, we are piloting a system at the Chogo Health Facility in the Sanarugu district. It's an electronic system that's supposed to gather data about each expectant mother who comes there, and then this data is used by the health staff to really understand the conditions of their patients, of their clients, and to be able to better attend to them. We have also recognized that we do not have a lot of data about maternal mortality, child mortalities in Ghana. A lot of the data that you will find are the generic data, at the national level data, but when you drive to the communities, then you do not find any scientific data about these. And so what we have done currently is to provide funding to 6 researchers who are conducting research on critical topics about maternal and child mortalities in Ghana, and about the causative factors and issues that can contribute to the reduction of the mortality rates. And so we have 6 researchers who we currently are funding through the fund, and then they are currently working on their research data, and very soon they will have their research work completed and will publish this research finding and contribute to knowledge about maternal and child mortality rates in Ghana.
T4MCH is contributing toward the achievement of SDG 3, which aims at ensuring the well-being of all, especially women and children, by 2030.
They register us, so through that we were able to get periodic messages, and I was directed how to handle my wife. I shouldn't get my wife involved. I shouldn't involve my wife in so many hard activities. So, and when I follow their periodic messages, how they teach me how to handle my wife, really I'm able to exceed. And we have a very bouncing baby boy.
Initially, we were not using those things much to give training to our clients. But when Savana Signature came in, their program is helping a lot by communicating with our pregnant women when they are not even in. When they come, we really educate them what to do when they are pregnant from day 1 to the time they will give birth through technology.
T4MCH is garnering the support of communities to harness the power of technology towards ensuring successful deliveries and invariably healthy lives and well-being for all at all ages.
So these are the efforts that Savana Signatures is putting in with funding from the Global Affairs Canada and in partnership with Salasan, our Canadian partner, to contribute to having healthy mothers and smiling babies.
But